Welcome to this video on Pharmacology Made Simple. This high-yield NCLEX review will cover the key information you need to recognize, remember, and answer pharmacology questions with confidence. Pharmacology doesn't have to be about memorizing thousands of medications. The NCLEX tests your ability to recognize drug classes, identify side effects, know nursing interventions, manage adverse reactions, and teach patients safely. One of the easiest ways to identify medications is by learning their name, endings, or suffixes. Knowing these tells you immediately how a medication works, which is a great tool for the NCLEX. ACE inhibitors, ending in pril, are used to treat hypertension and heart failure. Watch for side effects like a persistent dry cough, hyperkalemia, or angioedema. Remember, a swollen tongue or difficulty breathing is a medical emergency. ARBs, or angiotensin II receptor blockers, end in sartan. These are used when patients cannot tolerate the cough caused by ACE inhibitors. Monitor blood pressure, kidney function, and potassium levels. Beta blockers end in LOL and are used for hypertension, heart failure, and arrhythmias. Always monitor heart rate and blood pressure, and be sure to hold the medication if they are below your facility's parameters. Calcium channel blockers, such as amlodipine, are used for blood pressure management. Common side effects include peripheral edema, dizziness, and constipation. Teach patients to rise slowly to prevent falls. Diuretics come in different forms. Loops like furosemide can cause low potassium, while thiazides also risk low potassium and hyperglycemia. Spironolactone is a potassium-sparing diuretic. Remember, loops lose potassium, while spironolactone saves it. When dealing with insulin, always verify the dosage. Know the onset of your patient's insulin relative to their meals, and monitor closely for signs of hypoglycemia. Anticoagulants require careful monitoring. Heparin requires checking APTT levels, while warfarin requires monitoring INR. Newer agents like apixaban usually don't require routine lab monitoring. Always assess your patient for signs of bleeding. For antibiotics, monitor for side effects like diarrhea or allergic reactions. Red flags include difficulty breathing or anaphylaxis. Patient teaching is vital. Ensure they finish the entire prescription, even if they feel better. Opioids like morphine are powerful analgesics. You must monitor respiratory rate, sedation, and blood pressure. The antidote is naloxone. Respiratory depression is always the priority when assessing these patients. Benzodiazepines are used for anxiety, seizures, and alcohol withdrawal. Be aware of side effects like sedation, falls, and respiratory depression. Flumazenil serves as the antidote. Digoxin is used for heart failure and atrial fibrillation. Before giving it, check the apical pulse and potassium level. Watch for toxicity signs like nausea, confusion, or visual disturbances. Digoxin immune fab is the antidote. Statins, such as atorvastatin, are used to manage cholesterol. Monitor liver function and for signs of muscle pain or dark urine. Teach patients to report severe muscle aches immediately, as this could indicate a serious reaction. Steroids like prednisone, methylprednisolone, and dexamethasone are powerful anti-inflammatory medications. Watch for side effects such as hyperglycemia, increased risk of infection, weight gain, and mood changes. It is crucial to teach patients that they must never stop steroids abruptly. When administering thyroid medications like levothyroxine, timing is key. Instruct the patient to take it first thing in the morning on an empty stomach. Avoid taking it with calcium or iron supplements, and remind patients that it may take several weeks to see the full effect. When answering NCLEX priority questions, keep safety at the forefront. Ask yourself, is the airway threatened? Does the medication affect blood pressure, respirations, or potassium? Could it cause bleeding, hypoglycemia, or falls? Choose the safest answer to determine the correct response. Memorizing antidotes is high yield for exam success. Know that naloxone reverses opioids, flumazenil reverses benzodiazepines, vitamin K reverses warfarin, protamine sulfate reverses heparin, digoxin immune fab reverses digoxin, and N-acetylcysteine reverses acetaminophen toxicity. Here are final tips for success. You do not need to memorize every medication. Focus instead on drug classes, common suffixes, major side effects, black box warnings, nursing interventions, and patient teaching. Understanding these core concepts allows you to answer thousands of pharmacology questions with confidence. If this video helps simplify pharmacology, continue with the rest of our NCLEX high-yield series covering cardiac rhythms, lab values, and more. Remember, don't just memorize medications, learn the patterns, and you will recognize the correct answers.